I always learn a lot from him, always get inspired by him. Suhail, Chughtai, please.
Thank you, Shahid, for this very kind and generous introduction. Honorable High Commissioner, your presence is very symbolic. I haven't seen you spend so much time with doctors in the past. That shows your interest, the kind of interest you've taken in this. This is very encouraging, and I must say this will go a long way in getting this message across from this day.
For my own health's sake as
We won't go into detail. I want to actually start with bridging the doctor with the patient. That is what I do through I'm an orthopedic surgeon, but at the same time I design telemedicine solutions. I've been doing it for 15 years for many countries. And connecting a psychiatrist with a patient is one of the easiest things to do in telemedicine. And I want to take you through a journey, how this has helped around the world. Now, what is telemedicine? I think you all know that. Video conferencing is not telemedicine only. It's clinical decision support system merged in video conferencing, wrapped as a website, is telemedicine. What is telepsychiatry? Telepsychiatry is when you actually diagnose a mental illness on telemedicine. You prescribe medication, you do counseling, you follow up medication, and actually you pull the patient out of a border where he could be suicidal. So that communication to help someone mental illness, you may not have an eye contact, but your voice, your body language, your use of expressionism, your empathy can connect you across the screens from miles across. And that is telepsychiatry. You ought to be extremely good communicator. Psychiatrists are, psychologists are, but when you use telepsychiatry, extra skills are required because you have to maintain eye contact. When you're talking to somebody or talking to the patient, you need to look into the camera so that he or she can feel that the person is looking at me. And when you're listening, you need to look at the monitor so that you look at the eyes of the person who's talking to you. So, I want to take you through a small step. What, why, and how. So what part is that a psychiatrist and a patient can be directly connected. Or they can be connected by a facilitator. Sometimes you require a person sitting next to a patient because you're not there to help the patient, like hypnosis, like some therapy. I think you guys know much better than me. What therapies require support, supervision? So that is the facilitated telemedicine or indirect telemedicine. Then you have live telemedicine, live connection. And then you store and forward. When the patient answers a questionnaire on a video and records it, sends it back to you, analyze that, and you go back to him or her. The third part is multi-channel telemedicine. When the patient's relative from some other country can be in the conversation. Or you can have two psychiatrists, a psychologist, a psychiatrist, or a counselor. So that's multi-channel telemedicine. So there are many ways how you can connect with the patient. Now, but why we do it? Well, I think the evidence is growing that diagnosing a psychiatric condition on telemedicine has become almost 93% accurate. That is the American Psychiatrists Association. And I'm sure the British Psychiatrists Association have done a lot of work, and the college has been very instrumental in the research work. And I rather appreciate the comments you made today, and your commitment to work is exemplary. So, why are we doing it? The evidence is growing that the patient, in some conditions, it's better to do telepsychiatry. For example, a physical disability in a psychiatric patient. You're going to put all the way a limping patient with hip pain or back pain for counseling. Why not do a telepsychiatric session with the person so that you avoid that for adding further to anxiety because of pain? Very high anxiety. People who are scared to go out and meet people and have eye contact, they can be better off on telepsychiatry. So there's a growing evidence that what is better is that the diagnosis, especially 93% plus accuracy, is amazing trait we've learned in the last 20 years. 1994, WebEx, New Zealand, psychiatrist counseling was the first tele-video consultation. And that is how it started. So it's your field which actually brought tele-video consultations. Now, American Telemedicine, American Psychiatrists Association, they did a study in June 2020. We were through the pandemic. They had 600 members of their own, practicing psychiatrists. And they asked them, how many of you practicing teleconsultations? 61% said, no, we've never done it. In January 2021, that number decreased to 19% only. So they were convinced because it's now patient driven. Just try to understand the difference that before we were saying we will see you on video. Now the patient is saying, can I see the doctor on video? And that pendulum, that paradigm shifting is going to drive the industry forward now. So those 500 psychiatrists were asked in January 2021, how was your patient? 90% of them said, my patient was happy at the end. And he wanted to book a follow-up appointment. So that is where we stand now. And I think the way we're moving, I give you my personal experience on this. I do telemedicine, I conducted my orthopedic clinics. I couldn't come to Harley Street clinics and there was a pandemic and all this. So I converted my physical practice into telepractice using my own software. And I've seen more than 1,000 patients on that in the last 18 months. I've never had a patient smoke in front of me. On telemedicine, someone did. And you know, there was a level of informality which connected that patient to me. There was a lady the other day, an old lady, with a cat in the lap, and she was petting the cat. And I said, why are you doing it? She said, I feel so comfortable. So there is a connection which telepsychiatry can make. Physically, it's like patient coming to you. Telepsychiatry, you are going to patient's home. And then look at the comfort the patient will have. Look at like if you go to patient's home, now your waiting room actually is the patient's video screen. While waiting for you, the patient can check emails, can go and answer the door, can look out for the kid. So that comfort on telepsychiatry is going to drive the industry forward. I mean, my father was a pediatrician. I remember him, his clinic when I was a child, that one patient requested him, can I smoke? I'm getting tremors. And that was the last time I saw a patient smoke in front of a doctor in the clinic. And the second time was this. So this industry is going to boom. And if you learn it now, you're going to be actually in the right seat. And otherwise, having to learn when you cross 55 or 60, it's learning from 20 years old. Could be a barrier. So thank you very much, High Commissioner Saab and Shahid. You've always been phenomenal in setting the big events, important events. Deputy High Commissioner Dr. Faisal is with you, and I appreciate all the heads of the organizations. I wear two hats today: World Congress of Overseas Pakistanis, a 10-year-old organization, and Association of Pakistani Physician Surgeons. I'm the digital director, digital medicine director. So I appreciate your time. Thank you very much. Thank you.
Thank you very much, Suhail bhai. And absolutely, in person, working in the NHS, I know for a fact, and our colleagues would know as well, the benefits of virtual communication. I mean, hospitals, we've always had problems with parking, with office space,